Okay, so here's the marketplace website information. You input this information. It asks if you're employed, probably, and if you're employed, whether or not your employer offers you health insurance, you know, those types of questions. The open enrollment period began in a very rough sort of way in October, and it goes through March 31st for open enrollment. Now, from here on out, after this initial attempt, then every year, just like Medicare Part D or whatever, from like October to December will be another open enrollment time for people. If you still don't have health insurance, you can get back on and sign up. But after April 1st until October 1st, supposedly, you won't be able to. But like if you get fired or something like that, that's a qualifying event. Okay. There's both tax credits and subsidies that you get on. You input your income information, premium tax credits, cost share, and subsidies. These are all ways to pay for the health insurance. This is one I want you to hear. Federal poverty level for a family of 4 last year was $23,550, right? Affordable Care Act provides tax credits and subsidies for individuals up to 400% of the federal poverty level. So a family of 4 making $94,000 a year is entitled to subsidies from the federal government for their health insurance, right? For a family of 2 up to $62,000, you are entitled to some amount of subsidy through the Affordable Care Act. The other thing they're doing is they're raising the federal poverty level. See, for a family of 4, $32,500. In 2013, it was $23,500, $32,500. So they're raising the federal poverty level to 133% of the prior numbers. What's that going to do? Everybody below the federal poverty level is Medicaid, right? So now, family of 4 making $32,500 or below is all going to be shoved off to Medicaid. So if you're on the exchange, how many people do you have in your family? 4. How much do you make a year? $29,000. Sir, I'm now transferring you to the Medicaid website, and they'll sign you up for Medicaid. See, that's the expansion of Medicaid. That's where they're expecting 400 to 500,000 more Hoosiers will be on Medicaid when this is all said and done than what's currently on Medicaid. These are several examples of that. Real quick, household income, 200% of the federal poverty level. Insurance might cost them $11,200. Under Affordable Care Act, they only have to pay $2,900. The other $8,200 will be the subsidies or premium tax credits you do not have to pay. That will be covered by the federal government. And you know, when you get into different types of scenarios, you got much larger subsidies. Who's paying for these subsidies, right? Right. Okay. It's meant young, invincible young people are supposed to be signing up for Affordable Care Act, paying a bunch of premiums in, and not using the insurance. And that's one of the big ways to pay for all this. Right now, they're still trying to fill that piece of the puzzle in. Okay. So what do you do? Here's what's going on with the employers. Employers are even down to only 5 employees are now starting to do things like self-insured plans. Usually, in the past, self-insured plans are just for major, large employers. Now they've got products out there where small employers, like my firm, if we wanted to, we could go to a self-insured plan. And that's coupled with a major deductible catastrophic insurance plan that's real cheap, kind of like what you see with health savings accounts. But we also work on a self-insured plan and start dumping money into a self-insured plans for our employees. That's something that you're seeing a lot of now. Another thing you're seeing a lot of now is a health plan that's kind of like a defined contribution retirement plan. But it's employers are saying, here, I'm giving you $800 a month in your health plan account. And here are the 12 kinds of health plans you can pick from. And so employees are going to start picking and choosing their health plans based upon the amount of money their employer is giving them, right? They get insured that way, but it reduces the cost of the employer because they just set a budget. We're only paying $800 a month per employee for health insurance. That's it. Anything above that is yours. You know, that's another thing we're seeing a lot of. So the whole thing is changing. Everything's changing, the way people are thinking through it and the different products that are coming out. What should you be doing? This is based a lot on employers, not necessarily individuals, but you need to be thinking about where you're going to be getting your insurance. Is it through an employer? If you're retired, then where's your insurance going to come from? If you're at risk of being unemployed, where's your insurance going to come from? You need to probably sit down with an insurance advisor that knows a little bit about it, and there's more and more of them popping up. All you have to do is look around, and you can find them. There's several in Evansville that know a lot about what they're talking about. Maybe sit down with them if you think that you've got a problem down the road about where you're going to get your insurance. They know what the products are, what the trends are, and where this insurance is going to come from. Still, a lot of changes going to be happening with the Affordable Care Act. They're going to keep changing and keep changing and keep changing it. And I'll keep getting to add different slides to this presentation or taking others out as I go. But that target's going to keep moving. And there's going to be a lot of movement in the employer environment as far as what they're offering employees and what they're not offering employees. Your exchanges are going to evolve into different things than what they are now. So there's going to be a lot of unanswered questions. What's going through your minds right now, having zoomed through all of that? Well, and again, I'm conjecturing here. I'm not providing you facts, but you hear people talking about that the uninsured are going to be hard-pressed to do anything to become insured because the uninsured, why do they want to become insured? You know, you have a lot of that mentality. You know, they can still go to the ER. Mm-hmm. So there's some conjecture about, does all this pull the uninsured into the insured ranks? And that's left to be seen. I think for these 30 million of uninsured to be pulled into the insurance rank, I think it's either going to happen by most all of them going on Medicaid. And then you've got another financial crisis of the different proportions. That's going to be state-provided Medicaid funding, right? But it's going to be mainly Medicaid or other ideas that are developed to pull more of them into the insured ranks. And if you wanted to get really skeptical, you can get on and read all about how all this is geared towards just ultimately getting to a single-payer system.
What is that?
Single-payer system is just the government providing you your insurance, like Medicaid. That's single payer. Is a Medicaid type program that everybody has to be on. But that's conjecture. Yeah, you talk to hospital administrators in Indiana, and they'll tell you that the only way that they can survive financially is to reduce the number of Medicaid provided patients. But what this is doing is the exact opposite. So the hospital administrators aren't figuring out how to actually make their ends meet. And these requirements that plans have to provide certain things, that they have to be based upon community ratings, pre-existing conditions, et cetera, et cetera, et cetera. All those things increase the cost for the insurers, right? So now to me, I just wonder how long the Anthems and the Med-Bins and et cetera, are going to be able to continue to provide the plan.